The Barthel Index measures the extent to which somebody can function independently and has mobility in their activities of daily living. This assessment looks at feeding, bathing, grooming, dressing, bowel control, bladder control, toileting, chair transfer, ambulation, and stair climbing. The index also indicates the need for assistance in care based on the total score out of 100. It is a widely used measure of functional disability. The index was developed for use in rehabilitation patients with stroke and other neuromuscular or musculoskeletal disorders, but may also be used for oncology patients, older adults, or other nonspecific patient populations between the ages of 18 through 65 plus. Last week, 26-year-old Allie went to the hospital after experiencing weakness and numbness in the right side of her body. She was diagnosed with left side ischemic stroke and stayed in acute care for 5 days, where she received both occupational and physical therapy. Hi, my name's Jenna. I'll be your occupational therapy student for today, providing in-home therapy. How are you?
Good, how about yourself?
Great. Okay, so can you please state your first name and your birthday for me?
Allie Gallagher, March 1st, 1996.
Perfect. That is what I see here in the chart. Okay, so am I hearing and reading it right that you were in acute care last week in the hospital after having a stroke?
Yes.
Okay, so I know that you received both occupational and physical therapy, and I was just wondering if you remember what occupational therapy did and kind of what we do for you?
I remember more of the physical therapy.
Okay, well, we are a little different than PT, physical therapy. So basically what we do is we just make sure that you can accomplish the activities that you do in your daily life that are very meaningful to you. So this could be things such as basic activities such as feeding yourself, bathing, dressing, getting in and out of bed, that type of thing. And so my main goal is to see if we need to make any modifications in your house to make you be more successful, or basically go back to how you were prior to your stroke. So just to make sure, you had a left ischemic stroke and it seemed to affect the right side of your body.
Yeah.
Okay, so basically we see that your middle cerebral artery was blocked. So what that means is just a blood vessel in your head was clogged. So this can cause symptoms such as weakness and decreased sensation, probably in the right side of your body. Did you experience any of that? Are you still?
Yeah, I had a lot of that in the hospital, but not really anymore.
Not anymore? Oh, perfect. That's great to hear. So what about trouble understanding or getting speech out, trying to talk to people?
No.
No problems? Very good. Okay. So a couple questions before we get started with the assessment. Do you live alone or do you live with anyone?
I live with my significant other.
Okay, perfect. And do you have any other support coming and visiting you? Can they help you with getting stuff done if you need it?
Yeah, I have some good friends that stop by.
Good to hear. Okay, so are you experiencing any pain
No.
at this moment, or have you since you got home?
No.
Okay, very good. Okay, so basically what we're doing today is called the Barthel Index Assessment. So what this is we're going to try to see your level of independence with basic activities, like I explained earlier, eating, dressing, stuff like that. And I just want to see your potential for assistance and if you even need any assistance. And then we're going to just establish a plan and kind of see what goals we need to make, and it's going to be a very collaborative effort. Okay, so to get started, first I wanted to ask, do you feel stable? Do you have any fear of falling?
No.
Okay. And so first we'll just start with bathing. Have you taken a shower in your own shower since you've been home from the hospital?
Yeah.
Okay, very good. And how was that? How was bending down, the balance, washing your hair, your body?
I got a little unsteady when I went to bend down, but I think it was more just getting my bearings, and I didn't fall.
You didn't fall?
Mm-hmm.
Now, do you fear that in the future you might?
No.
No? You feel totally okay? Okay. And what about your bowel and bladder? So going to the bathroom, are you going regularly? Do you find that anything difficult with that?
No.
No? And what about wiping yourself?
No
Do you
problem.
have any trouble turning, getting down on the toilet? Okay. And how about transferring to the bathroom, onto the toilet? Any problems stabilizing yourself, getting down, any loss of balance? No?
Not that I've noticed.
Not anytime since you've been home. Very good. Okay. And what about stairs? I know you live on the second floor of your apartment. And do you have any trouble getting up and down the stairs? And do you
you have any, like, do you get out of breath when you get to the top? I know that sometimes we do, but we're looking at how were you prior to the stroke and how are you now? Does it seem similar?
Pretty similar. I go a little bit slower now, but
Okay.
no real problem.
No problems? You think you can get like up and down fine without any assistance?
Yeah.
Yeah, okay, very good. Okay, so now I want to just kind of see you perform these activities. So we're gonna start with putting on that jacket right next to you. I just kind of want to see what you do, how you do it. And I know that you probably have dressed yourself since you've been. Any trouble?
Again, a little bit slower, but no real problems.
No problems? Okay, good. All right, try to put it on and then zip it up for me. Let's see. All right, that's good. Perfect. Okay, now if you're too hot, you can take it off. That's fine. Okay, good. Now we will move on to the kitchen. I'm just gonna see how you do some things, some butter, some toast. All right. Okay, so I know, and we've previously talked about how you love toast in the morning. So I just want to make sure that you can use utensils and you can butter the toast just fine with no issues. So if you could just show me how you do this. I also love the Star Wars plate.
Oh, thank you. It's my favorite movie.
Is it? Which one's your favorite?
The first one.
It's a good one. It's a classic. That's good. Perfect. Okay, so now I'm just gonna have you walk to the chair, sit down, get comfortable. Let's see how you do. Perfect. Great. And you could get up and let's see you get into bed, how you normally would at night. Get all comfortable.
And lay down.
And lay down, yeah, just to see how you do. Okay, perfect, great, looks great. And you can get back out of bed. Okay, great. Okay, so now I'm just gonna have you walk back to the chair, sit down. Perfect, beautiful, independent. Okay, so now I'm gonna have you sit on the toilet as if you're going to the bathroom. Perfect, okay, and kind of mimic wiping yourself and make sure you do it. Great. Okay. And have you had any trouble putting your pants back on, or doing buttons or zippers or anything?
I've been a little slower doing it, but I'm still able
But
to
it's
do it.
pretty functional. You can get it back on. You don't need any assistance.
No.
Perfect. That's what I like to hear. And also, laces on your shoes. Have you been able to tie them?
Yeah.
All by yourself?
Yeah.
Perfect. Okay. So next, I'm gonna have you come up, stand up by the sink, and kind of mimic brushing your hair. You don't actually have to do it. That's good. Great. And have you had any trouble washing your face in the morning?
No.
Okay. Perfect. Any brushing your teeth? You can do all the movements but independently. No trouble there? Okay. Great. So I just want to see how you walk up and downstairs, and I'll be following you so whenever you're ready. How did that feel? Good. Good. And last question, do you think if you could you walk 50 yards? And that's about half a football field. Yeah, you'd be pretty independent now? Okay, great. Okay, so today was great. I see that you are independent in everything. And so next session we'll kind of go over results and maybe discuss some goals. We'll make some goals together for the rest of our time together. But thank you so much for letting me come into your home.
Yeah, thanks for coming.
All right, see you next time.
All right.